Since the beginning of time, human beings have struggled to understand life and the environment in which they live. They have been seeking the origin, the meaning, and the purpose of their existence on Earth. Intertwined by intriguing mysteries, humanity formulated the most diverse theories of mythical, theological, and even rational nature to explain their vision and role in the world. These theoretical approaches were the foundation for the birth of religion, philosophy, and science in all ages and cultures. In the beginning, ancient medicine was sustained by the spiritual view of the world, which was the prevalent idea of the time due to the lack of other possibilities for the understanding of humans and their pathologies. Since the time of Hippocrates, the ancient Greek physician, commonly referred to as the father of Western medicine, spiritual ideas dominated the medical knowledge. These ideas were recognized as viable and alternative hypotheses. Throughout the development of medical knowledge, there was a clear predominance of spiritual schools, decisively influencing medicine. But in the beginning of the 19th century, with the advancement of the current science, a new mechanistic mindset started offering new explanations for the so-called rational understanding of the phenomenon of life. From that time, these spiritual ideas were banned from medical conceptions, replaced by what was considered to be scientific advances, which later was called materialism. This materialistic view considered any ideas that links the phenomenology of life to metaphysical connotations of the spirit as a setback. The universe lost its spirit, and the man his own soul, and materialist ideas began leading the scientific thought, and soon after would involve all areas of the human knowledge, distancing itself from the unequivocal benefits of divine faith. Now, following the impulse of materialism, medicine goes in search of a new concept of man, health, and disease, and therefore new therapeutic techniques which could adapt to the innovative vision of the modern human being. And so, from the first quarter of the 19th century, Western culture is witnessing the full implementation of this mindset in current medical thinking. The 20th century has brought with it great scientific advancements. Medicine has begun to unveil the mysteries of the physical body, thus enabling the discovery and treatment of several illnesses, and most of all, the prolongation of physical life. Technological and industrial advancements have provided potent medicine to prevent and cure old, uncurable diseases, and complex surgical procedures can be done more efficiently utilizing state-of-the-art equipment, but yet complete integral healing of the human being continues to be a challenge for modern medicine. But it was also in the last century that new discoveries have shown, especially in the medical field, that the spiritual ideas are indispensable to explain life and the human complexity. Some research findings have shown, although not yet officially recognized by the conventional scientific community, the presence of a domain of subtle energy in living beings, called by many scientists the biological organizational model, or psi phenomena, that envelops the physical body. Evidence of quantum physics attests, as secured by the ancient spiritual ideas, that the phenomenological reality lies steeped in non-physical domains. A spiritualized medicine will take into account the existence of an immaterial being in command of the biomolecular structure and network, in which it should prioritize the stability of the organism. Therefore, the effective treatment will be done from the inside out, that is, finding and treating the cause buried in the soul, as the material body receives the appropriate intervention. A new paradigm in medicine. Medicine and spirituality. Integrative medicine is defined as healing-oriented medicine that takes account of the whole person, body, mind, and spirit, including all aspects of lifestyle. It emphasizes the therapeutic relationship and makes use of all appropriate therapies, both conventional and alternative. Medicine sustained by a spiritual view has already been practiced for quite some time in the Western world, with broad support from Eastern traditions practiced under various names such as Reiki, fluid therapy, acupuncture, spiritual healing, body reading, herbal medicine, anthroposophy, homeopathy, and many others. Complementary health practices attempt to understand the disease as an energetic imbalance that can only be corrected in its imponderable and immaterial origin. The quantum physicist Dr. Amit Goswami has proposed a new view to explain the causality of light, what he has called the descending causation, in contraposition to the materialist and reductionist theory of the ascending causation. In addition, Spiritism can make great contributions to medicine and schools of thought that deal with human health. The World Health Organization has defined health as a state of complete physical, mental, and social well-being. Spiritism, however, extends this view and teaches that health is a state of complete bio-psycho-social spiritual welfare, because it takes into account the biological, psychological, social, and spiritual factors that influence the human being in its passage through earthly existence. Unlike the medicine of matter itself, which is still carried on by a large scale of practitioners these days, Spiritism unveils a new model, the medicine of the soul. In the medical spiritist paradigm, the human being is a complex structure composed of the physical body, the subtle body, or called the perispirit, and soul, or the spirit. The main target, however, is the healing of the soul or spirit. It is therefore up to the immortal spirit to construct and maintain his or her own health. According to these concepts, the fact that a person does not externalize disease during some stage of physical life does not mean that he or she is healthy. Thus, the individual can appear seemingly healthy during a period of time, but the origin and seed of disease can be imprinted in the paraspirit, which will later manifest itself according to the law of action and reaction. According to the Spiritist principles, the health-disease issue is deeply linked to the law of cause and effect. The spirit doctor, Andre Luis, explains in the book Action and Reaction that karma means cause and effect, because every action has a reaction that can transcend many incarnations. The medicine of the future. The medicine of the future, or the future of medicine, will incorporate a spirit, mind, body approach in order to promote health in its true meaning. It will understand that we are more than a congregation of atoms. We are a spirit experiencing a temporary existence in matter, and Spiritism offers a key to the relationship between body and soul, proving that one is constantly acting on the other. This idea opens up a new field in science by demonstrating the possible true cause of certain diseases, thus making diagnosis and curing easier. As the Greek philosopher Socrates once said, "If physicians fail in treating the majority of the ailments, it is because they treat the body without treating the soul." Welcome to the United States Spiritist Medical Association.